So Lisa, thank you for joining me in the DE kitchen.
No problem at all, Luke.
Obviously you're joining me today because Sue is unfortunately currently in isolation because her son is being tested with a highly probable case of COVID-19. So you're here with me, quite absolutely here with me, because of course the reason that Sue isn't with us is because she's in isolation, so she's not able to be in the business. An issue that is affecting dental practices, I understand, all the time at the moment.
Yeah, very, very similar. I mean, sort of the way that Sue has been affected will affect any dentists that come into contact with anybody that might be sort of a probable case of COVID. So they have to isolate. As a result of that, we have seen an increase in practices wanting sort of ad hoc cover, if you like, for a couple of weeks just to cover the dentist that's off. So it's it is affecting dental practices as well. Normally around this sort of time of year we'd see practices needing locum cover because of UDA targets. They want somebody to come in and help with the target ready for the end of the financial year in March. But obviously with the way things are at the moment, it is more sort of COVID related than it is target related.
It's a big, it's a big challenge, and it's becoming more and more common because I think as we kind of go into the coughs and cold season, of course this year, everyone is apprehensive of if you get a cough, get a test, and of course whilst you're waiting for the test results, which I have to say at the moment, people I know are coming back within 24 hours or so. You have to wait in isolation as a household just to make sure you're not infecting anyone. Now, in a practice setting, of course, that's 2 days you're without a nurse. Now, within those 2 days, you'd also have then a dentist who may not be able to work without a nurse, or indeed if the dentist goes into isolation. I think it's you forget and you go, okay, well dentists are okay because whilst they're at work they're PPE'd up to, but we're not talking about them necessarily picking up a cough or a cold from a patient per se. We're talking about the fact that of course dentists are normal human beings and they are at home with their families, and they've often got children who are going to school and mixing with 300 other children on a daily basis and bringing the germs back, and going to the supermarket, and it's so easy now, isn't it? People go, oh, it's the season for it normally this time of year because around Christmas everyone gets a bit of a snotty nose or something like that. But actually this year a snotty nose means 2 days out of practice,
potential COVID,
potential locum, covering the patients or cancel the patients. The very same patients who may have been waiting to see the dentist since March, because of course a lot of practices now have sort of got through, if you like, that initial wave of people who were in pain through the first lockdown, and now starting to see routine patients or patients who needed treatment, who have now got a bit of confidence to come back to the dentist, only to find that either they're not seeing the dentist they anticipated they would see, or they're not seeing the dentist at all because the book had been cancelled. And from a practice perspective, obviously cancelling a book does mean that it's cancelled EBITDA, cancelled lost profit. If you're a private practice, after 3 months of zero income, that you can ill afford that, and you're seeing that people are like, I need a locum nurse because
locum nurse, locum cover, just to help them get through that period. But what I would say as well is, on sort of a different side of it, if you like, is that practices are still very much looking for permanent staff also. Sort of what we're seeing is jobs still coming on. The candidate market is very busy. There's lots of candidates looking, and I'd say probably sort of before, we had a lot of locums registered with us that might be in jobs, but actually there's a lot of locums that are available now that we can place. So I'll say, and
that's because this year we went with the UDA rush, have we? So we would typically say that in sort of January, February, March, that was when you had lots and lots of more locums out than other times of the year, because it would be practice focusing on getting to that tolerance level, in order so they don't have clawback or a breach notice. Whereas this year, of course, 20% threshold on activity, not UDA's, of course, slightly different measure, but 20% threshold on activity, which in turn means that you're seeing that you're not getting that rush for that reason. In fact, the rush is more short term, so they don't want people for a month, they want people for 2 or 3 days, and they want them tomorrow because they've just lost a dentist.
It's urgent, of course, because it's something that the dentist or the dental nurse or whatever staff member it is that is having to go into isolation, they can't help it. They're having to do it based on the guidance that is out there at the moment. We are seeing sort of that rush. And as I say, normally we would come back after Christmas even, and there'd be this massive rush of inquiries for, we need a dentist to work up until the end of March. And as Luke said, it is a case of we need a dentist tomorrow to work for at least 2 weeks. So it's changed the dynamics of what practices are looking for at the moment.
But not a lot you can do about it, of course. It's one of the facts of life, unfortunately, at the moment. Obviously this week Sue not with us because she's in isolation. Last week Paul wasn't able to be here, my business partner, because he was in isolation. Just one of these things. So all you can remember is, as Boris says, hands, face, space.
Keep safe.